One of the biggest ones, and I'm going to tell you a story about it, is this statement that it's not about the money, especially if you're in a helping profession, right? Like physical therapy. Like we tell ourselves, it's not about the money. You're in this because you want to help people. Here's what my PT school professor never told me about PT school debt. If you're a student who is interested in becoming a physical therapist, you're in the right place. My name is Joseph Gugi. I'm a physical therapist, one of the co-founders of Pre-PT Grind and Cash in Class University, where for years we've helped students get into PT school and then graduate debt-free after that. So if you want either one of those things, or if you're interested in having a PT career that is just absolutely amazing, it fills all the dreams that you've ever had, then you're in the right place and we're gonna help you get there. Now, I wanna talk about money a little bit today because school debt is a thing that we've all seen, we all experience it. Some of y'all are paying off loans or debt from undergrad. Some of you are worrying about how you're gonna pay off PT school debt when you finish school, how you're gonna pay your way through school. And we've had students do some really, really cool things to help them graduate debt free. But I wanna bring you back to a conversation I had with a professor that could have easily thrown me off, like many other students and physical therapists have been for years. Now, there's a side of this whole debt situation where we feel like we have to just wait for someone else to help us, whether it's the government or whether it's the schools, or it's like someone has to fix it. It's just becoming too expensive. And it's interesting because there's certain things that you have a lot of control over when it comes to money, but a lot of it is because of certain things that we've been told that we have believed, and they're actually not as accurate as you might think they are. And one of the biggest ones, and I'm going to tell you a story about it, is this statement that it's not about the money, especially if you're in a helping profession, right? Like physical therapy. Like we tell ourselves, it's not about the money. You're in this because you want to help people. Part of that means that you really don't understand what money is, right? But it also creates some other issues, especially when that message is being given to us by people that are not in debt, right? Or people that graduated 15, 20 plus years ago when school was not as expensive as it is right now, right? Whereas there's some of y'all that are graduating school or will graduate school with $150,000 in debt, $200,000 in debt. It starts to not make a whole lot of sense. Let's talk about it because I'm gonna keep it real. Some of y'all might not like what I have to say, but for those of y'all that listen, you're gonna be all the better for it, all right? So I had a conversation in PT school with one of my professors. I think there was probably one or two other classmates where we were asking questions about school debt, like how to pay off school debt, like why is it so expensive? Why aren't PTs paid more? And I think part of it was the fact that it was a doctorate. So we were still trying to wrap our minds around the fact that wait a minute, shouldn't doctors of physical therapy be paid more? And we were just asking all these questions and just curious, honestly. Some of us at that point had already started doing some research online and learning from other people that were doing things a little differently to make their financial investment in PT school worth it, right? And one of those paths was business, right? So actually one of our first business coaches, Greg Todd, was one of the people that we had started listening to around that time. But I remember asking this professor this question. It was just about how do we deal with that? Why is it that PTs aren't paid more? Or why is it that there's so much school debt, but then we're paid the same as we were paid when we had a master's degree, when physical therapy was a master's, or when physical therapy was a bachelor's degree? And what the professor said was what I said a few minutes ago, which is it's not about the money. It's not about the money. It's not about the money. It's the statement that we kept hearing. It's not about the money. You're in a helping profession. If you wanted to make money, you would not have chosen physical therapy. And a lot of us just accept that. We're like, you know what? Yeah. And then what happens though, and this is where it becomes dangerous. What happens is we start to associate helping people with not making more money. It's almost like making more money is seen as bad. It's this thing, and it's part of it is how we've been taught. I mean, think about it. Every movie you've seen since you were a kid that has a wealthy person or someone that has money, it's always portrayed as evil, right? And so we have this weird connotation with well, if I make more money, then I'm taking more, or I want to make just enough to not be selfish, and all these narratives that we've heard. And it was so connected, and it's really, really still connected even in healthcare. And it's screwing y'all up. And the reason why it's screwing y'all up is because there are people that are leaving the profession because they can't make it make sense financially. I have peers, I have classmates that have left the PT profession because they're like, I'm in so much debt, I gotta figure out some other way to make this make sense because what I'm getting paid as a new grad PT ain't adding up. Right? And I'm not telling you this to scare you away from physical therapy. I'm telling you this to help you understand that there's a few things that we might believe or have been told about money that we need to unlearn if we want to make this not only make sense, but also fulfill a lot of the dreams that you've had. Like take a brief moment real quick and just think to yourself, like, what did you dream of? Like when you initially decided to become a physical therapist, what did you want? Some of you will say, well, I wanted like flexibility. I wanted like time freedom. I wanted to like have my weekends off. I wanted to have a job that paid well. Side note, when you're getting paid minimum wage, well, getting paid $80,000 as a PT sounds like a lot of money until you realize what that actually looks like with school debt, with taxes and all that stuff, right? So it's like, well, like part of our perspective was maybe a little bit off, right? But then we also have this narrative of it's not about the money, it's not about the money. So what happens is a lot of people get into the profession, we get into a lot of debt, then we graduate, and it's not just PT, it's dentistry, it's MDs, it's like y'all, I can go down the whole list, but then we graduate with a lot of debt, and then now we're stuck where we're like, okay, so how do I pay this off? Do I go to a branch of physical therapy that's not as fulfilling to me? Like what if the only way for you to make more money is for you to do a skilled nursing facility, but you actually are not fulfilled doing that? And side note, it's okay to not like certain branches of PT, even if you want to be a PT. Like I have friends that don't like working with adults. They are like straight up pediatric PTs, and they're like, I love working with kids, adults, not so much. I have peers and colleagues that are the exact opposite. They're like, I'm not really a fan of working with kids, peds wise, but I'd love to work with the geriatric population. Or I want to work with sports or whatever. Like think of the branch of PT that would fulfill you the most. What if it's not the one that pays the most, right? Like, are you going to basically give up your entire career doing a different branch of PT just to make more money? You just have to decide, like, does it make sense for you? Does it not? But let's go back to this conversation of it's not about the money. A lot of people have been told that, and a lot of the times we just have to be very careful we have to first of all assess, like, who are we getting that information from? Are we being told that by someone that understands our pain, that is currently going through the struggles that we're currently going through, someone that has actually been able to navigate how to get out of debt? Or are you talking to someone that has either given up on the fact that they're just going to be in debt for the rest of their life, or maybe they just weren't in as much debt to begin with, because a lot of our professors had been in the profession at that time for 15 plus years. So what they paid for school is very different than what we were paying for school, and the pay hadn't changed a whole lot. So now you start asking yourself, like, something isn't adding up. So we got to start asking very, very different questions. And so the first thing, and here's what I wish the professor would have told me, but remember, PT school's job is really not to help you make more money. Their job is really to just help you graduate from PT school and pass your board exam. That's really it, right? So, but what I wish I had learned then, and I learned it in other ways from business coaches and things like that, but what I wish I had learned even earlier was the fact that part of it is about the money. Yes, I know we want to help people, and that's part of it, but I think sometimes we forget to think about what does our ability to help people look like when money is not a stressor, right? Like I remember the first time, this is probably like in 2019, when I didn't actually have to work as a PT anymore. We have multiple businesses, but it was 2019 was the first year where I didn't actually have to work as a PT anymore, like in terms of like actually treating as a PT, because we had figured out other ways to serve people and make quite a bit of money, right? And so I remember what happened when I would go into the clinic and I would actually go and treat patients simply because I wanted to treat patients, because I genuinely loved being a physical therapist, right? And it's a very different feeling just going in and serving people because you want to, because it's just it's a different feeling to go from having to do it because I need to get another shift over the weekend. I need to have a part-time job to, make ends meet. It's a very different feeling of having to do things out of the desperation for more income just to make ends meet and pay off loans and pay for your life because life's expensive and all that stuff, versus being able to figure out the money part and actually be able to give without that stressor. Does that make sense? And I don't know, I pray that at one point you feel that, but it's one of the most beautiful things ever, where you can literally give without the expectation of return, where you can literally give simply because you want to serve people. Even for us, with what we do online, we've helped way more people than have paid us, right? There's a lot of students that have been served by our platforms over the years and have never paid us a penny, but because we actually have our money side figured out, we know that there's always going to be a fraction of people that will pay us, right? But there's going to be a lot of people that won't. But we've set it up so that we were like, wait a minute, hold on. This money part is actually important. And if we can figure that part out, then we can actually do more of what we as healthcare people love, which is serving people, help people without feeling drained, without feeling this desperation of just trying to figure out where more money is, or feeling drained or feeling exhausted or fatigued or whatnot. Like take a look at like our energy. Like, have you noticed that when you see a piece of content from us, we actually look like we want to be here? Like, we look like we want to serve you. We look like we actually have a lot of energy, because we do. Like, we love what we do, but we're good financially, right? And so as a student, start asking yourself, wait a minute, is the whole concept of it's not about money, it's about helping people, does that actually match up if the reality is that if I'm really, really stressed financially, I'm not in a position of just giving like abundantly. I'm in a position of survival. I'm in a position of like, shoot, like I gotta figure ish out. And that's how most people live their careers. And that's why a lot of people end up actually leaving a healthcare career. Like, and I have peers, like I said, that have left simply because they were like, yo, I have to make this worth the investment. So it actually is a big chunk about the money, right? Anyone that leaves the profession, it's always about money. Anyone that feels overworked, underpaid, key part, it's about the money, right? I had a clinical instructor during my last rotation in PT school. He was frustrated. He was 32 years in the profession, probably one of the most bitter PTs I'd met. Almost made me reconsider being a PT. And PT is a dope for, like, it's a really, really, really cool profession, right? And he made me second think it, because I was seeing how unhappy he was, like as a clinician. And he would verbally tell people, like, I would not have picked physical therapy if I could go back in time. I would have picked something else that paid more. Like, it was all around me, right? And for some of you who have interacted with a clinician that just did not look happy or fulfilled, a big part of it wasn't necessarily the fact that they didn't like physical therapy. It's just the fact that they were drained. They were trying to survive, and it just didn't feel fulfilling anymore, right? But I can tell you this, when they were students, they were excited. When they graduated from PT school, they were excited. But at some point, maybe a few months after or a few years after, something changed, and it was because the money part. There's a reason why one of the biggest things that like clinicians are trying to get is more pay. There's a reason why you'll hear a lot of new grads that are doctors saying, we're not paid like doctors. That's a whole different conversation, by the way. But you're not gonna have that just handed to you, right? And I know we want it to be, but it's not gonna happen that way. So one of the first things we have to understand is that it is about the money, but then the next thing is understanding that it's actually on you. That's the other part, is I think a lot of times we are waiting for someone else to fix the money situation for us, whether it's the government or the school or whatnot, but it's actually on you. It's on you to take ownership of that. It's on you to actually make it worth the financial investment. So you have to start asking different questions. Who can I learn from? Who do I have around me? Who are people that I can have access to that have figured this out, and can I learn from them? Because if you start doing that, it'll start opening up doors for you. And then the last thing is you can start figuring that stuff as a student, right? Like, we started our first businesses as students, right? There's so many other things that you can do as a student, scholarships. Like, we had a student that started PT school after having over $100,000 in scholarship money, right? So she was basically giving herself a full ride via scholarships. We've had students make as much as $23,000 in a month. And if you think I'm joking around, go to www.newmoneyptlive.com and you can actually see some of those stories. That's an event we have coming up this September, where we're gonna, for 2 days in Tampa, Florida, actually teach you all this stuff step by step by step to help you all freaking crush it, right? These are real things. And you can see all of these stories and realize that there's things you can do now to be at the driver's seat of this whole conversation of money, right? But it is about the money partially, right? And I get it, like, we want to help people, but it's actually interconnected. And I think a lot of us have just learned the opposite, that it's not about the money, it's about helping. But then when you realize that if I don't have the money part figured out, it's very hard for me to help as many people as possible, then you realize that you're actually shortchanging the thing that you actually want. And then when you start realizing the fact that you had a dream initially when you chose to become a physical therapist, and that dream is only fulfilled if you figure out the money part, then you kind of start realizing, shoot, I got to figure some ish out, but I got to do it as a student. Don't wait till you're a physical therapist. I think sometimes we also think, I'll wait till I'm a PT, because if I wait until I'm a PT, then I'll have more time. Y'all, listen, I was just as busy, if not more busy, when I became a PT. Like, it doesn't work like that. Start now, figure it out now, do it with other students now, because you're not the first, you're not the last, but there's other people that have already figured it out. And if they figured it out, then why can't you? And if you want us to teach you, go to that same link that I just said, newmoneyptlive.com, www.newmoneyptlive.com. Get a ticket. We're actually, like, 2 days. You're gonna spend 2 days with us in person. I don't even want you to consider the fact that, like, it's impossible. So I want you to be in a room with other people. We're gonna have nearly 125 students in person that are gonna learn all this stuff step by step by step. And then the students that have been able to do some of the stuff that I mentioned a few minutes ago, they're going to be some of the speakers, and you'll be able to learn from them directly, ask them direct questions. Actual students in PT school right now doing those things that may seem impossible, making more money than your average physical therapist. And you can do some of that stuff as well, whether it's through scholarships, generating more money, reducing the amount of expenses that you have when it comes to what you're paying off for schools and all that stuff, so that you have freedoms. Like, freedom is the goal, right? Like, as a new grad PT, you want to have freedoms. And so whether you're a pre-PT or PT student, that's where to start. But that's also what my professor never told me about school debt. So hopefully that helps. Let me know if you have any questions about that. And if you enjoyed this, please be sure to share this out with another friend, another classmate, another peer that would value this. And of course, be sure to like, subscribe, and just binge on the rest of our other content on here. And we'll see you on the next training. Bye.